right side.
Wrong.
No?
We might start here. We have to be on the right side.
So there's a surgeon, they're going to be doing that the whole time.
That's true. Okay.
The gallbladder's on what part? What quadrant?
Left.
Upper right.
Upper right.
Upper right.
Oh yeah.
Upper right. Why is the surgeon standing on the left?
Better. Camera better. You're coming in better.
You have long instruments. If you stand here, you're not going to be able to see anything. You have to go long instruments across the body. Okay? Make sense? So they may start over here, but you both are going to be side by side on this side. So you have to make sure that your table can go over here. Your table's going to go with you. Okay? So on every OR, I want you guys setting up to where you are going to be on the patient's left. So I always like, this is my left hand, I'm going to be over here. And then I set up. Okay? If you were going to put any arm out, it would be the right, because we're only here for a short amount of time, and then come over here. Make sense? But both arms are tucked. So you crack it. You take your Q-tips that are invisible. You can see them, right? Long wooden Q-tips. You get a little ChloraPrep, and you clean their belly button. It is nasty. It is gross. Nobody cleans their dang belly button. Okay? You use 2 of those, hopefully only 2 needed, okay? And then toss that. Then you take this. Where am I going to start?
Belly.
Where's belly button is the incision site. It's, again, the dirtiest, okay? We're going to start on incision site, 30 seconds, okay? Once we go there. We're going to go round, 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 okay? Not contaminating this, not touching the bed, but getting like down to the bed, okay? Down to the bed, mid-thigh, not the genitals. Stay away because this is not for this area, okay? So if they do the thighs, they stay away from any mucosal membranes in the
So
downstairs
you go
area.
to like above the pelvis?
Yeah, so you go like above, okay? So that would be your prep, okay? So I want you guys practicing as circulators too. Please do not crack.
That's the one you don't shake?
You don't shake it, you crack it once,
You wait.
and you wait, okay? Don't,
You're going to see it, but not
you'll see it all the time, okay? Patient is prep. You as a circulator, what are you guys saying? What are you asking?
As a tech, I'm saying, is my patient prepped?
And has it been?
Has it been 3 minutes? I was looking for a yes.
3
Patient
minutes.
been prepped?
Yeah, sorry.
Has it been 3 minutes?
Yes.
Thank you.
3 minutes. Why 3 minutes? What are we waiting for?
The
dry.
To dry, because it's what? Flammable. So that's the prep. This is part of a checkoff, is abdominal draping, positioning, prepping.
All right. Good morning, Dr. Kelly.
Morning.
Mr. Kelly, dear. Today, how are we doing?
Good, there we go. See how she takes it down below and she pulls it up to my neck? You guys try to chop each other's chins off. You guys come up here. I'm down here. Okay? Yes, yes, correct. But I'm the surgeon, so it's not.
All right, patient's been prepped. 3 minutes.
Left side, yeah. Okay, so the first drape we're gonna do is a 3/4 sheet. What's our rule on draping? We don't pass anything over an unsterile field. Okay? See, we love the basin. Okay, because we can bring it with us. You guys all have to back it up. Okay, so we're gonna go over the patient, open it up, set it down. Okay? And then, and only then, can you pass the towels over the 3/4 sheet. If there's a board vitals test question, you are standing on the same side. If there is no 3/4 sheet, you are going to stand on the same side of the surgeon to pass the towels. Make sense? So your test questions get real tricky, right, Sean?
Yeah.
Yeah. You are going to stand, if there's no 3/4 sheet, you are going to stand on the
Can we
same
get
side
table
of the
down,
surgeon.
please? Can I fix the last one?
Yes.
Thank you. See, covered completely.
Oh yeah, I forgot you guys learning this skill.
Also no adjusting on
That's
the
good.
report sheet. Once you place it down.
You got more lights on? This is a dark procedure, but we need to go in first. So, big belly drapes. Do you see our person? Okay. So they them. Head, foot.
A human.
Our human.
You pass it to the
Pivots.
doctor with your hands on the outside, their hands go on the inside. Okay, you take it.
They're gonna verify because they don't trust.
We don't trust, the surgeons don't trust that you got it right.
That's fine.
You're gonna pass this side, we're not gonna drop the drape. This is a new skill for you guys, right? Right, yeah?
Yeah.
Okay, so you're not gonna drop it. Why? And now we're not sterile anymore because you keep it up here. You're gonna grab this, roll your hand.
Look at our hands. Look at our fingers. We're covered. Beautiful.
So students are famous for wanting to grab way out here. See all this clustery? Stop doing that. You're gonna come to the inside. Okay, come up here. Stop trying to grab out here.
You don't need the end. You don't need to find
You
it.
don't need it. Find the end is sitting right here staring at you. Take it. Okay, everything that we do during draping is a roll of the wrist. Okay, this is an arm board. If the arms were out, this would cover the arm board. Okay, now you guys have to learn how to hold this sucker. Real fun. You can now pull it away from your sterile field, but you cannot bring it back up. Make sense? So we can adjust this way, we can adjust our pockets. Okay? Now she's going to bring up her mayo.
I use that.
Um, Well, you can put that at the end of the bed because we do that with the.
You want it?
Yeah, I do.
I'm gonna be on your side.
Oh yeah, that's right.
Because of the way you do it. Gotta be careful with your mayo. They don't like moving.
Especially when they're full.
Yes, they're full, they're heavy, they don't want to move very
You
well.
don't want to drop it.
Watch your patient's legs.
Do not hit your patient's legs with your mayo stand. Okay. Move the table. Your circulator can help you. If there's an assist, they could help. Retract.
Okay. All right, let's do timeout. Patient is Jason, what is that?
Quartet.
Quartet. Date of birth is 7/18/1982. Here for a lap poly with Dr. Kelly. No drug allergies.
I can't see.
Yeah.
If it's
It's fine,
done.
it's fine.
Instruments are sterile and accounted for. Anesthesia, have antibiotics been given.
They've been administered.
All right, agree? Or
Yes.
Risk
questions?
is low.
Fire risk is low. All right.
Okay, cords. You can do the timeout either before the cords or after the cords. Some of my surgeons will not do timeout until all the equipment is plugged in and it's all working. Because we don't want to cut and have a bleeder and our camera cuts out. But some of them do it in the beginning, so
I don't like stuff like this.
to each their own. No, we throw those away.
So this part goes off to the circulator. You have to find out where section is first. Where is section? It's probably on this
It's
side.
over there.
Right, so I'm going to hand it to someone over here. I throw, you grab. If you miss and it comes back, it's going to hit the bottom. It's not going to come back onto my field and contaminate, right?
This
Give
is your
yourself
guys'
enough
first time with
slack.
cords, right?
This is cord management.
Okay.
Give yourself enough slack so if they miss or you
Just
need
set
to.
it down on the bed. And don't take
Also
it too
on
much.
that, real quick, I just want to add something because I've done it before. There's a little plastic part that usually is supposed to be on that tip where it's going to be punctured.
Yeah, it's right here.
You guys do not take that off.
It fell off, but
You guys
okay.
will take that
Yeah.
off. The nurse
Put it
will
back
take that
on
off
if
and
it falls.
they'll spike the bag with that. So
This
that's
thing?
still, yeah.
So that makes that sterile, to stay sterile. I'm so sorry.
Yeah, so that pulling that, so that tip has to go into a sterile bag of fluid. And if you take that off, that's contaminated to that tip and now you can't have it. If it falls off on your field like it did with Miss Garza, stick it back on because we're sterile. Make sense?
This is going to be doctor for irrigation later, so I'm going to say, hey doc, there you go. This is my irrigation, or my insufflation tubing. Insufflation's over there. This filter goes off. Okay?
The filter goes off.
So again, enough slack. Don't touch me, but
Stick it right there.
be stingy because your circulars like to take everything. Do you want this on your side also?
Yeah.
Take
So we
care.
love the pouches. Okay, the pouches are sterile. So I know table level is sterile. The inside of the pouches are sterile. The top of the pouches are okay, sterile. Not when you come down here though. Okay. Hi.
Hey,
So if you're not sure which end to pass off, what do you do?
See which one connects.
you should actually make sure it all connects before you put it on because sometimes they
Yeah.
don't. And like, we need a connector. No, we don't. So
So
that's
if you're
my
not
end.
sure, you connect it. Okay. Because you would not just laparoscopic, but ortho. There's a ton of ortho equipment that the connectors look identical. So I connect it, and then I'm like, okay, I need to pass off the other one. Usually it's the male gets passed off, the female stays. Guys all get it? Okay. That's what we say in surgery, okay? Oh, male goes off.
You guys
Female
remember
stays.
cameras and how to put cameras on the scope?
Yeah, it's on, right?
One caveat, I was quizzing Sean about this. You see this cap? It processes like this in the Sterad machine, not steam, because 270 would melt this cord. So it goes through the plasma process through hydrogen peroxide, and the cap has to stay on or else it kills the camera. If you do this, now what? It processed with the cap on. Is this sterile?
No.
Do not do that on the fields. Okay? You leave the cap on. Pass it off. They take the cap off and plug it in. Okay? We had a whole bunch of spine bringbacks for SSIs. And we found out that it was because the tech was taking off the cap, or no, yeah, taking off the cap on the field because they were like, oh, well, it's sterile inside. And I was like, saw this giant metal cap and I saw it sealed. And I was the tech that was like, how is that sterile on the inside? There's a giant metal cap and it's sealed. How is the steam or the sterilant, whatever that sterilizes that, getting to that area? And they were like, I don't know, how does it? Oh, we looked it up. It wasn't sterile. So all of those patients were getting surgical site infections because the tech was taking that cap off. So it's near and dear to my heart. Don't take that off, okay?
Also,
You
this
wanna
whole
put it in?
time when you guys are doing this, the light's on. It's already connected. You don't want that on your drape. It'll cause a fire.
Oh.
So you would have it either hanging off or on your mail, somewhere where.
During open house or what, something, we melted the drape because we left the light on.
Oh, yeah. So I want you to notice when I'm untangling cords and I'm doing my cord management, I'm not up here, right?
Rookie move.
It's all here, and then just give yourself, just control it.
Mr. Valencia, you mean the light cord? Like
The
this
light-
part?
the-
Or just the end? The tip?
that's it.
Bobby over there?
You see how it's on?
Bobby's
Uh-huh.
over there.
That part.
Okay.
That
That
tip.
from the camera. Yeah. that's
Bobby
where
and suction are on the same side, and the tower's on
Technically,
typically
you
the
usually have
opposite.
it connected. So sometimes you'll pass off that cord, don't connect it right away, it'll turn off. Just connect it to your camera already. Have your camera somewhere where it's not touching the drape.
Cord management is going to be your worst nightmare. Okay? I'm not kidding. If this is not, and Miss Garza did a beautiful job of laying it out properly, but if the camera cannot do what it needs to do and it's all wrapped up in all these other cords, the surgeon's going to be real frustrated. But it needs to be able to back and forth. And if your cords are not proper, then it's not going to work. Okay? This one sticks. Not anyway. So you have to make sure that all your cords are nicely placed and they are stayed up. If you do not, and they fall down, now you're delaying the case and you're causing money to go down the drain. Make sense? So cord management is key. We love our pockets. We put everything in our pockets.
Not all drapes have them. Do our lap Foley drapes have them?
I think so. I think we have
Okay.
brand new ones that we can use. Can I get the? Tip.
Is it this one?
Yep, just a tip. Thank you.
Just the tip.
Okay, you would prime it. Fluid would come down. It's primed. Okay. And that goes there.
Careful, don't poke holes in the back.
Yeah, yeah. Don't shove it through. Just gently place it. Okay, we did timeout.
Yeah, we did.
We
Marking
need
pen?
Fred. Yep, marking pen.
You just put it here. Do you want it on your field?
Yes, Fred right here.
And
Fred
then-
is sticky. We don't unstick it because we're in school. Okay, but Fred goes on the fields. Okay,
Does it matter where Fred goes on the field?
it does. I'll show you in a minute. Okay, they feel for the iliac crest, the belly button.
Sorry.
Okay.
What is this? I didn't mark it. 0.5% marking.
Okay. It's gonna be back.
You don't do incision for yours, do you?
Incision first.
For Varus?
Okay, sharp back.
11 blade? Ooh, it's a tiny needle.
Sharp back. On the Varus, they are listening for, and we'll see if it does it. Ah, did you hear it? Okay, that pop tells us that we have popped through, hopefully, but I need a saline check to be able to test it, okay? So we're looking to go through all of the layers, and we are looking to pop through the peritoneum. Once we have popped through the peritoneum,
Normal saline?
the saline will be able to go, and they only need a couple drips. Again, we don't have a human body, so it doesn't work as well. But the saline is going to go through, and it's going to go through the end of here, okay? And if they are not in the correct layer, it will not go through. It will stay up top, all the saline, okay? It'll pop again.
Love it.
Okay?
And
Gas on?
Yeah, so
Gas on. So your circulator is going to turn the gas on, then what happens? Everything starts to fill, right? They kind of tap it like a watermelon because you can hear that it's changing, okay?
and
So-
gas always on high. Sometimes you'll have it on low and you'll kind of see it slowly go up.
Yeah, so every doctor is different on, but the circulator controls that. We don't have to worry about that, okay? So now I'm going to be ready for a trocar, so I'm going to tell her to take this out as she passes me the trocar with it closed. Yeah, see? So it's like this, okay? So she's going to take off the,
there's a 15, I believe. Is that good?
yeah. I was hoping that it cut through.
Blade?
No, I need camera. All right, so this comes out, okay? We got to put the insufflation back on the trocar because it's not a one-time fill on the belly, okay? It is a consistent fill on the belly, and then open it up. Okay, so she had the camera ready for me, okay? Can I get light on? Our light boxes are a little temperamental. Juan is our IT guy. He's our biomed. Okay, so I'm going to keep going, but you put your camera in, okay, and you're going to watch it, and you're going to be able to see your layers eventually, okay? So now that that's happening, she's going to take the cap off.
Oh, yeah. 0.5% marking.
Is the camera close or open? Or the tip?
No,
Can it be
it's
from
the
that
light
side?
cord.
It's the light that doesn't want to run.
Needle mat.
Scalpel. Gonna be a 5.
Sorry.
Sharp back.
Make sure you close it.
It doesn't want to turn on higher. This is supposed to turn it up.
Okay, the one thing that we didn't troubleshoot before we started this case.
I thought we did. Oh, the light.
Yeah, I didn't troubleshoot the light.
0.5% marking. You good?
Yep. You see the pattern?
Yeah.
Another 5.
Yeah.
One more.
Yep.
Ooh, I stuck myself. My cap wasn't on. It wasn't clicked, so that's dirty. I need to go change. So make sure this is clicked when you put it on, because when I went to take it off, it came off and I stuck myself. Okay? Like, make sure it's closed. These are hard.
Yeah, they are.
Use different hypos. It's closed. That's a 12. Make sure it's back on safety. Alright.
Okay, so that is getting into the body. Okay, this is a transition point number 1. We are into the body. We don't need any of these. So that's why I have the basin usually about here, because I dump those suckers
I'm gonna switch the towel.
in here. Okay, go ahead. We're
Once
gonna
we're
keep
in.
going, but go ahead. Okay, so now she's gonna transition. Bringing up her laparoscopic instruments, and I'm gonna run to the other side in a second. Okay, you don't really need this. You can put this down here. Your instruments are probably best with a handle to the surgeon.
This time is 6 hours.
Huh?
This time is 6 hours.
Say what again?
It's all sterile.
Yeah, they
And
go
they're
off
not
our
going
mail.
down.
Everything's sterile, so if it hangs off, it's okay, because we're now over the patient.
Okay.
Makes sense.
When you have drills and you're doing ortho and stuff like that, stuff does hang off in the laparoscopic.
All right, so this, the bovie comes off. I hand it to my tech. The doctor's going to put this, not all of our hooks fit, including this one, okay? But this is what we call a Megadine hook. You see the hook as in you saw the videos, okay? This is the cautery hook, okay? So it's gonna go on here because I have the buttons. So I'm gonna use the buttons here. If not, they need a foot pedal. Okay, so that's gonna go here. Doctor's gonna come over here. Okay? So I'll have Mr. Valencia with the tower real fast. All right, I'm gonna excuse me, doctor coming through. Doctor coming through.
Same thing.
All right, so the reason for Fred being where Fred is at.
You unplug?
Okay, you can move over there if you want.
Yeah, you guys can shift. So the reason for Fred being where Fred is at, I put Fred normally right here for a reason. Because when I take my camera out and I need to clean it, who cleans my camera? Fred does. So I want it right here. Okay, so it's all soapy and sudsy. Okay, so if I stick it to the drape right here, I'm going to be able to do that. Clean. Go back in. Out. Clean. Clean. Go back in. Okay? The more time you spend outside of the body, the worse it. Remember, patient needs to be out of anesthesia as fast as possible. Okay? So,
When she's in, what's she gonna do first? Look around. Take a look-see. We're in, so we're looking.
yep.
It's plugged in.
And this is a 0. This, because it's a 0, no matter what position that you put the light cord, it doesn't change.
What does 0 mean?
It's got no degrees.
No degree slant. There's no.
If you have a slanted one, when you spin this, it changes the slant. So the doctor will tell you, and next semester we have you guys drive the camera. Okay? Well, we might do it this semester.
We'll try.
So the doctor may say, take the light cord and turn it to 3 o'clock. Turn it to 6 o'clock. 9 o'clock.
Because it turns the scope.
It will turn the angle of the
Take
scope.
this off. This is exit.
Just leave it. It'll go away.
Okay, look
Oh
at
yeah. Okay, so
press and hold knob to exit menu.
I need to make sure that before I put it into the body,
White balance. And zoom.
it's
Nice.
focused,
Oh my god.
and I would hit
They didn't get this. No.
We got pictures.
white balance.
Like a printed off of a
So
computer.
did you guys see what happened? Well, I already did it, so I can't redo it, but the colors are off. Every time you plug in a new camera, the colors are off. So there's a W button on here. You'd have to white balance against something white. If you white balance against something blue, now the blood looks green. Okay, makes sense? So you have to white balance against something white. All right, so we white balance. Now we're gonna go in.
After we did a look-see, Well, I guess keep going. Ooh, there's momentum.
Okay.
Can't see much because the angle.
There's my other trocar. I'll take a grasper. Yep, lights go off. Thank you, Oscar.
Why do they want to grasp her first? And to grasp.
Why am I watching this? Why did I watch my instrument go in? So you don't slam it into the liver or the aorta, okay? So a lot of my Grey's Anatomy watchers, one of the patient died after a lap chole because they weren't watching the trocar go in and they punctured. Yeah, it was a little kid, wasn't it?
Yep.
Yeah.
So if you go towards the omentum, towards the not
So-
cephalic, the caudal side.
All right, hold the camera for me. Remember, I'm not a surgeon, so.
Yeah. No, it's okay. So if you go towards, get all that out of the way if you can. Other way. Down.
Is it?
There you go. There's
All
the
right,
liver.
there's our liver. Okay, we have to get the omentum out of the way. What position are we going to take the
The grasper.
So see how she's holding the camera and working at the same time. That camera better not move when she moves. You get it? So if I ask her to do something and she starts to do it and she starts going like this, you can't. Okay? And the numbers of the camera, the buttons, always face the ceiling. Because if not, look what happens.
Upside down view.
So the buttons always face the ceiling at all times. Okay?
What do you need to see? Where's your other port? There you go. There we go.
So because we have a mannequin that doesn't have an insufflated belly, our trocars are in too far. Because again, you have to imagine the belly's going to be about 5 inches higher.
So I'm going to
Okay.
put the camera on the trocar so my doctor can see. And then try to get that and the liver at the same time. Grasp it. There's a gallbladder. Look at this scales.
Okay, so I'm going to take this liver and I'm going to tilt it up. I'm going to lock down my grasper. Okay, and this is my...
Is it locked?
Locking mechanisms are not always great on these trocars or these handles. No, it's not working. Okay, so you would lock it. It's not working. We're going to pretend. Okay, I need one more grasper.
Did I grab another one? I have a
Yeah,
Maryland.
oh, Maryland's perfect. So you want a Maryland? One that works. Okay.
Detroit.
Okay, because the Maryland is the one that creates the window.
You guys are so lucky I can't even.
Oh, see, my grasper doesn't work, but what I'm going to do is I'm going to lift the liver. I'm going to take the Maryland, open and close it, creating a duct. Okay. And my grasper's going on. We're trying to give you real world experience, but it doesn't work with felt and balloons very well.
Doing pretty good, I think.
And a grasper that doesn't work.
Look at me, the tech. This is you.
You want a grasper that works?
Yeah, I want a Maryland that works.
But this is like
And
a
don't
pretty good-
move. And my back's already hurting.
Because what's happening with her mayo? Where's her mayo at?
To my way.
Digging in to her body.
And I know
Okay.
my armpit's not sterile, but it is what it is.
That's good,
So,
Armando.
do you want me to move? There you go. There you go. Beautiful.
Always dealing with the omentum. So this is why we're going to reverse T. What's reverse T mean? Reverse
Head up.
Trendelenburg. We're going to reverse Trendelenburg the patient so that all of the omentum goes to the feet of the patient. Lower abdominal area. Okay? These things spin. Yes. Okay, this is going to be a Maryland. It's not really, but we're going to pretend we're going to create the cystic duct and cystic artery, a critical view we call it. We're going to create the window. Okay, now I'm going to take
How still that camera is, I don't know.
clip. I'll grab it because she is.
No coffee today?
Hold on, I'll let go of the Maryland. I got it.
I got it.
Yeah, coffee.
So, when you have a surgeon you're by yourself, the
Put it
surgeon
on.
will grasp the stuff. Okay? I'm gonna have you guys grab it. So we can't do this for every case. This is just a special event. Okay?
I want you to visualize what we're doing in there in your mind.
Come in a little bit. Right about here. Yeah. Okay. So I don't know if these clips actually work, but you would clip, clip, clip.
How many?
3.
That's right.
And then you would cut. Then what am I going to do after this?
In the bag.
No, there's a duct and then there's a, where are you?
Alright.
Cut.
Okay, so I'm going to cut, and then, so you guys should have in your hand at all time when you clip first. Have the clip in your hand. Now what does she have in her hand? I can see it in the corner of my eye. She's got the next cut in her hand. See how that works? See how close we are? I could, if she didn't shower for the last 3 days, I could smell it. Okay? She showered. She smells fabulous. So, okay, and then we're going to cut that cystic artery. Okay? Now, everything's cut. Everything looks good. I put my hook, right here, right in front of me, where it should be. Okay? Now I'm going to Bovie. Okay, I'm going to Bovie off the gallbladder from the liver bed, just like you guys just saw on the video. Okay, so I'm going to Bovie that off. It's all Bovied. Okay? Now I'm going to take my endo pouch. Okay? The wording facing the ceiling. Because when you open the bag, I don't have a bag on here, but when you would open the bag comes this way. If you give it the opposite way, it's not going to work. So the letter's facing up. Okay?
What's his name's not taking pictures?
Oh.
He was over there.
Taking pictures?
Yeah.
Oh, okay.
So we're going to put the bag in.
I'm sorry, I'm in surgery.
Find my bag somewhere.
There we go.
Yeah. Remember, I'm not a surgeon. If I was, I'd be a lot better at this. Okay? So now I'm going to take I don't have it bovied off. I'm going to
They
increase.
rip really good. I'm just gonna tear it. It's just one staple.
Okay. So my bag is open. I'm going to take my gallbladder.
Maybe.
It's a strong staple.
Almost done.
That was a really good cut. Yeah.
That grasper. I hold that.
Yeah, there you go.
There you go. It's off somewhere now.
There's a little thread left.
Almost.
Right there.
Yeah.
Good job.
All right, so I'm going to take, this is one of the hardest part of the case because sometimes you guys are going to do this.
Catch it back.
Everybody's like, yeah.
All right, so sometimes you guys will actually have to take the gallbladder and put it into the bag. And it's actually a lot more difficult than you think it is. I'm going to do it now. Okay, so you put it into the bag, it goes into the bag, and then the entire trocar comes out with the gallbladder and the bag, which it's not in the bag, so I'm going to pull this out like this. The gallbladder is going to be hanging, so picture a sack hanging from this area. Pull the gallbladder out. There's going to be a string, hemostat.
Sorry, it's not close. Shame on me.
So the hemostat comes and it's going to hold the string. So picture a string right here. We're gonna take the whole trocar out because the gallbladder is right here. Okay, because it can't fit through the trocar. No gallbladder's gonna fit through there. Okay, so we pull it out through the skin. The little string, I'm gonna grab it here. Gallbladder. Put my trocar back in. Okay, so she has her specimen. Then I'm gonna take my suction irrigator. Okay. Okay, we're gonna suction, irrigate. Is there any bleeding? No bleeders. Then we're gonna come out. Okay, if there's no bleeders, we are gonna come out of all the trocars. We're gonna watch, I'll take the camera. We're gonna watch the trocars come through the belly. Okay. Because we need to know if there's gonna be any bleeding. So watch what she's doing. Don't watch what I'm doing. Watch what Miss Garza's doing. Light off, gas off, lights on. Can you hit the box? Just off, is fine. Beautiful.
Do you want camera off too?
That's fine. Doesn't matter. Okay, oh, here's a couple more. All right. So again, the reason for the standby is so that we don't burn the drape.
Can we take a picture of your mayo now?
Yeah, bigger picture. Oh, no, not yet. So yeah, real world is we keep our suture up there. I don't want you guys keeping your suture up there.
I got a rat tooth to add in with teeth. I don't know what you're gonna use.
Yeah, the closing. That works. So this is now your third transition, right? Entry, laparoscopic, exit, closure. Okay? All right, let's go. I'll take gas retractors. So the reason why that this would be a really, like the needle is smaller and it's really, really curvy is because, can you guys see how big my hole is? It's this big. I have to be able to get this needle into the fascia, and with this needle, it would never happen. Okay? So there's specific needles for a reason. It's called a UR6, orectal, and then a rat tooth. And for this purpose, I'm just going to move it up. She loaded it perfectly, but I'm just going to move it up because of what we're doing. Sometimes you'll have an assist on these cases. So if you have an assist, your assist can hold retractors while you do what? Start counting. Okay.
All right, ready for count?
We're doing Echo?
Oh. Instruments as well, right?
Mm-hmm. You're fine.
Ratex, I have 1, 2 on the field. 3, he's got to see me. 4, 5, 6, 7, 8, 9, 10. I have laps with me. Laps. I have 1, 2, 3, 4, 5. All right. Sutures, I have 1 working. 2. Hypo, I have. Oh, 1 on this one. 1. Blades, I have 1, 2, 3, and 4. Bovie, I have 1.
Fred?
Oh,
It's on the floor.
thread, I have 1, 2, 3 pieces. Instruments. What do I have ready? Did you count a Bear's needle? No. Ready?
Yeah.
Penetrating cow clamps, I have 1, 2. Lorna's non-penetrating, I have 1, 2 on the field and 3. Needle holders, or not needle holders, mosquito, what are these, Kelly's? I have 1, 2, 3, and 4. Alice, I have 1, 2. Needle holders, 1 working and 2. That's it for string scissors. I have 1, 2 straight male, 1 curved mets. Retractors, I guess we'll do, no, 2 pickups. Pickups, I have 1 rat tooth on the field, 2 rat teeth. I have 1 Adson with teeth, 1 DeBakey, 1 plain Adson.
Cut. There's a little air knot, so that's good.
Retractors, I have S retractor, 1 on the field, 2. Army Navy 1, 2. 1 ruler, 1, 2 sen. 1, 2 knife handles.
Correct.
Counts correct.
So what did you notice on that count?
Field first.
Field first. Okay, then Mayo, then back table. And you stay with your stringed instruments.
Do you want the gallbladder off the field? You want to
Yeah, go let it
touch
go
it,
off.
Phil? Touch it first and open it. All right. Circulator, can you grab the specimen? Sean, I'm sorry. You're Sean. Can you get? I know.
Would it be the same? Would it be the same as a DNC? Like, what is it? How do you want to send it?
Every single
Yeah.
specimen.
Okay.
Every single specimen is the same 3 questions.
How do you want this sent, doctor?
Permanent.
You don't want to touch it.
Good.
Okay. Gallbladder sent permanent.
What am I feeling for?
We like to feel everything that comes out.
We feel everything. If you don't like to feel specimens, do you even belong in the OR? I don't know. Okay, done. Start back. Done with that layer. What did I sew up? What did I sew?
Take fascia.
Fascia. Okay.
I have a 4-0 for you.
Sure.
Okay. Now the coffee's kicking in.
You still using traumatic forceps?
As in with teeth. So I mean, yeah, they're traumatic, but we don't. They're a skin. They're a skin pickup.
Okay, Sean, I'm ready for last count.
Okay.
We're closing skin.
I'm doing sub-Q, and then skin's going to be
sub-Q.
dermabond, but it's the same thing.
Prep count.
Okay.
But you want to record. Ray Tech, I have 1, 2 on the field. 3, 4, 5, 6, 7, 8, 9, and 10. Laps. I have 1, 2, 3, 4, and 5. Always looking back, seeing where my doctor's at. Blades 1, 2, 3, and 4. Suture 1 working, and 2. Hypo 1, and Bovie tip 1.
Good.
Fred? 1, 2. Do you have 3 pieces on the floor? Alright. Good? Yep, so it counts correct.
So the monocurl could be for, it is skin, but it is a sub-Q.
Can I get dermabond,
Sure.
please?
Would that be for each port that you entered?
Yeah.
You're doing a count for the fascia? No, just the big one, the umbilical one.
So they most of the time they just sew the umbilical fascia. Some of the other big ports they might sew the fascia, but I rarely see that. It's usually the umbilicus. Do you see them sewing fascia on the other big ports? Right. So it's usually the umbilical area because that area is more prone to hernias.
So what would they do to the other one? Just dermabond the top?
Just throw a sub-Q stitch in it.
Sub-Q and
Yeah,
then...
I have seen doctors that don't even throw a stitch in any of the small ports. They pinch it together with their forceps and they dermabond it.
Wow. Thank you.
Okay, so sub-Q is done. Stitch back. Good. We're going to teach you guys how to cut as well. Okay? So dermabond is just like the, this one's really old. It's just like the ChloroPrep. You crack it once. You wait for it to come out. That little filter clogs the glass. So if you keep cracking it, all the glass gets clogged with the filter. And then you squeeze the ones together and you apply the dermabond.
Do you want,
The soap glass.
right?
Yeah,
I'm good.
I'm good.
Try quicker.
Final count?
Here.
Alright, Sean. Laps, I have 1
Raise.
on the field.
Raise.
Raise, 1 on the field. 2, 3, 4, 5, 6, 7, 8, 9, 10 on the floor. Lats. 1, 2, 3,
What are the last
4,
Raise.
and
No,
5.
we take what were they up here?
Suture I have
blood.
1, 2. Blades 1, 2, 3, and 4. Hypos I
Lots of
have
blood.
1. Bogey
Not
tip
lots,
1.
but-
Fred 1, 2, 3 pieces on the floor. Good? Final count's correct, Doc. Thank you.
All right, so that's a lap Coley. Again, we're gonna go really fast. We're not gonna wait for the camera and all that to work. Okay?
You guys see my field at the end of this case?
Would
I
that
don't
be
expect it to be that way, but when you're attacked, it needs to be like this.
for the test out? Is it included? Like depending.
Because-
or
why
is
do
it a-
Keeping it
Why do
clean.
I want to keep
No,
it
no,
clean, organized,
like the whole
and put back
procedure.
together?
Depending on what it takes, it doesn't matter how long it takes.
Turnovers, baby, turnover, faster turnover, faster turnover. I'm already.
So 45, the procedure is part of your 45-minute time. We don't stop your timer. Okay, so that's why we go speedy. That was probably like 4 or 5 times longer than I go when I play surgeon. It's, find the window, create the window, clip, cut, Bovie off the liver, the gallbladder from the liver bed, back. I'm that fast. That's how fast I go because we don't stop the timer for the procedure. 45 is part of the procedure. Okay? All specimens are all 3 questions. Every specimen for the rest of your life. Okay? So whatever that you guys do, that's going to be it. And then breakdown's the same. You guys already know that. Make sure they're not put together. So you guys need to know your trocars. Okay? Match the colors together with the makers so you can't really see the difference in the maker. When you peel pack these, have them open. That's open. And have them separate. Because they don't process like this. Okay? Then when the manufacturer processes these, whatever ethanol gas, whatever they use, won't penetrate. Okay? So that's what happens when you guys throw my trocars around. They
5
start to do
cc's
this.
local given, Sean.
So when you peel pack them, separate. Okay? And if you want to get real crazy, you want to peel pack them in a way that these go down. Like you guys play badminton ever? Yeah, so you want these when you open it. That's a little complicated sometimes. Again, I like my basin here because I throw all my disposables in here at the end of the case. Okay, I love my basin at the end of the case. I take anything disposable in those ones, like the bag, the scissors, and I put them in. At no cost. Okay? Any questions? Because it's going to be fast and furious.
Is there a
Okay.
proper way to take this off? Or just throw it?
Huh?
So the light cord and the
Until
camera
your
cord
lap
are
cord is out.
reprocessed, so we need to grab these,
Every Monday, Tuesday.
roll them up nicely,
How many are we gonna be
wipe them down as possible, which they don't usually need to, and then put them in with our instruments.
So the only
though
thing
they're
that's not
contaminated?
disposable are the
We're all
camera and
done.
the light cord.
That's disposable, these are not.
So all of that would be rolled into the drape. We don't even take it off the field.
Okay.
I take my camera and my light cord, and I take all of that, roll it in the drape, and throw it in the trash.
Yeah, we're done, patient's closed, we're done. I can grab this now. Right?
But you will break 0 field now?
Yeah, oh yeah, we're done.
The patient's gone already?
No, we're on the patient.
If you don't want to break zero fields, you just take your cords
Put them on your mouth. Something.
like this. That part's unsterile, and this part's sterile. And then you would roll down. Roll down your drape. Okay? And then all this would go biohazard. Okay?
How would you dress?
If it's Dermabond is a dressing and a skin.
Would you not even a alpha or nothing? Just like that?
So when you read